If you're over 60, there's a critical, often overlooked factor in your daily routine that could quietly escalate your risk of a stroke. This risk isn't just during waking hours, it's present every single night, without pain, without warning, while you sleep. Imagine going to bed feeling perfectly fine, only to wake up confused, unable to speak clearly, or incapable of lifting an arm. A stroke, silent, sudden, and life-altering. All potentially because of something as simple as the way you sleep. As medical professionals specializing in brain health, we've observed this devastating scenario far too many times, and remarkably, it's often not solely attributable to traditional risk factors like smoking, poor diet, or lack of exercise. Instead, it frequently stems from common sleeping habits that many older adults believe are harmless. They are not. Today we will meticulously walk you through 9 dangerous sleeping positions and nighttime routines that may be substantially increasing your risk of stroke, brain bleeds, or dangerous blood pressure spikes, especially during the quiet hours when your brain is most vulnerable. If you or someone you love is over 60, this video could provide life-saving information. So, please, pay close attention. Let's begin. The silent threat: how sleep position impacts brain health. Before we dive into the specific habits, it's crucial to understand the intricate relationship between your sleep position and the delicate vascular system that supports your brain. As we age, our physiological landscape changes significantly. Arteries lose their elasticity, blood viscosity can increase, and the efficiency of the baroreflex, our body's natural blood pressure regulation system, can decline. These changes make the brain exquisitely sensitive to variations in blood flow and oxygenation, particularly during sleep. The goal of optimal sleep positioning is to facilitate unimpeded blood flow to the brain, cerebral perfusion, and efficient venous drainage away from it, minimizing any form of vascular compression or instability. When these conditions are not met, especially for extended periods, the risk of ischemic events, strokes caused by clots, or hemorrhagic events, brain bleeds from pressure spikes, can rise dramatically. 2. 9 dangerous sleeping habits and how to mitigate them. Let's explore the specific habits that pose a risk to seniors during sleep. 1. Sleeping flat on your back with no pillow, supine, head level. The habit. Many older adults habituated to sleeping perfectly flat on their backs, often without a pillow or with a very thin one, believing it's good for spinal alignment or simply a long-standing comfort. The danger explained: physiological impact. When you sleep completely flat, your head is at the same horizontal level as your heart. While seemingly natural, this position poses significant physiological challenges, particularly for older adults. Impaired venous drainage. The veins responsible for draining deoxygenated blood from the brain must work against gravity more forcefully. As we age, these veins, along with the entire vascular system, lose some elasticity. This means blood can pool, slow down, and become stagnant within the cerebral venous system. Stagnant blood is a prime environment for clot formation. Increased intracranial pressure, ICP. Without head elevation, there can be a subtle but continuous increase in intracranial pressure. While not always symptomatic, elevated ICP can compromise cerebral perfusion, blood flow into the brain, and increase stress on fragile blood vessels. Cerebral autoregulation. Compromise. The brain has a remarkable ability to maintain constant blood flow despite fluctuations in systemic blood pressure, a process called cerebral autoregulation. In seniors, this system is often less robust. Sleeping flat can challenge this system, especially during the early morning hours when natural blood pressure fluctuations occur. Hypoxia and hypercapnia risk. For individuals with underlying respiratory issues like sleep apnea, even undiagnosed mild cases, sleeping flat on the back can exacerbate airway obstruction, leading to episodes of reduced oxygen, hypoxia, and increased carbon dioxide, hypercapnia. Both conditions are potent risk factors for vascular instability and clot formation. Who is most vulnerable? This position is especially dangerous for seniors with a history of hypertension, atrial fibrillation, sleep apnea, carotid artery disease, or those on blood pressure medications that might cause nocturnal hypertension, blood pressure dropping too low at night. The scientific adjustment. Slight head elevation, 15 to 30 degrees. The safest adjustment is to ensure a slight head elevation, ideally between 15 to 30 degrees. This can be achieved with 1 or 2 supportive pillows, or optimally, an adjustable bed or a specialized wedge pillow. This elevation allows gravity to assist venous drainage from the brain, reduces intracranial pressure, and promotes more even cerebral oxygenation. Pillow choice. Always choose a pillow that supports the natural curve of the cervical spine, preventing the chin from being excessively tucked towards the chest or extended backward. Sleeping face down, prone position. The habit. Sleeping on the stomach is a long-standing habit for some, often adopted for comfort, perceived back pain relief, or a sense of security. The danger explained. Physiological impact. The prone position is particularly perilous for the cerebrovascular system in older adults due to several critical factors. Vertebral artery compression. To breathe, the neck must be sharply rotated to one side. This extreme rotation can compress the vertebral arteries, which travel through the cervical spine and supply crucial blood flow to the posterior circulation of the brain, brainstem, cerebellum, and posterior cerebrum. Studies have shown that neck rotation can impinge vertebral artery flow by over 40% in some individuals. Reduced flow to these areas can lead to ischemic strokes affecting balance, coordination, and consciousness. Carotid artery pressure. The head sinking into a soft pillow or mattress can also apply direct pressure on the carotid arteries in the neck, further impeding blood flow to the brain's anterior circulation. Venous kinking and stagnation. Veins responsible for draining blood from the head and neck can become kinked, leading to venous pooling and stasis, increasing the likelihood of clot formation. Reduced lung expansion and hypoxia. Sleeping face down, especially on a soft mattress, can compress the chest, reducing lung expansion. This leads to lower oxygen saturation, hypoxia, which places additional stress on the heart and brain, and higher carbon dioxide retention, hypercapnia, further altering cerebral blood flow and promoting vascular instability. Older adults have a diminished ability to tolerate and respond to oxygen drops. Who is most vulnerable? Individuals with existing carotid or vertebral artery stenosis, sleep apnea, snoring, or those taking sedatives or sleep medications are at amplified risk. The scientific adjustment. Side sleeping with alignment. The best alternative is to switch to side sleeping, specifically the left side, which can also benefit cardiac function by reducing pressure on the heart. Use a firm pillow that keeps your head, neck, and spine in a neutral alignment. The pillow should fill the gap between your shoulder and head without tilting your head up or down. Body pillow support. A body pillow between the knees can help maintain side alignment and prevent rolling onto the stomach. Sleeping with a heavy blanket over the head, restricted airflow. The habit. Pulling a blanket over the head for warmth, darkness, or to block out noise is a common, often lifelong habit. The danger explained. Physiological impact. While it may feel comforting, sleeping with a heavy blanket completely covering your head can silently turn deadly for older adults. Hypoxia and hypercapnia. Enclosing your head under a blanket creates a confined space where exhaled carbon dioxide rapidly accumulates and oxygen levels diminish. This leads to progressive hypoxia, low oxygen, and hypercapnia, high carbon dioxide, throughout the night. Blood thickening and clot risk. Low oxygen and high carbon dioxide directly increase the risk of blood thickening, hypercoagulability. In a vulnerable brain, this environment is conducive to clot formation, even without traditional cardiovascular risk factors. Cardiovascular stress. The body compensates for reduced oxygen by increasing heart rate and blood pressure, creating spikes and valleys that stress already fragile vessels. This can trigger arrhythmias and further vascular instability. Cognitive decline. Even mild chronic nocturnal hypoxia is linked not only to an increased risk of stroke, but also to accelerated cognitive decline in seniors. Who is most vulnerable? This risk is not exclusive to those with diagnosed sleep apnea. Anyone whose breathing is disrupted by their sleeping environment is vulnerable. The scientific adjustment. Optimized sleep environment. Instead of covering your head, optimize your sleep environment for darkness and warmth. Use a sleep mask for light and earplugs for sound. Layered breathable bedding. Maintain a comfortable room temperature, ideally 65 to 68 degree Fahr or 18 to 20 degrees C for older adults, and use layered breathable bedding, e.g. cotton sheets, lightweight blankets, that can be adjusted without restricting airflow around the head. Sleeping upright in a recliner. The habit. Many older adults resort to sleeping in a recliner due to chronic pain, back, hip, acid reflux, or shortness of breath. For some, it becomes their primary sleep location. The danger explained. Physiological impact. While a recliner might offer temporary comfort, prolonged sleep in a semi-upright position, e.g. 45 to 60 degrees, places the circulatory system at a distinct disadvantage. Venous stasis in lower limbs. Gravity pulls blood downwards, away from the brain and towards the lower extremities. This leads to venous pooling and stasis in the legs and hips, significantly increasing the risk of deep vein thrombosis, DVT, blood clots in the legs. Embolic stroke risk. These DVT clots can dislodge and travel up to the heart, and then to the lungs, pulmonary embolism, or in cases of a patent foramen oval, PFO, a small opening between the heart's atria, present in about 25% of the population, they can bypass the lungs and travel directly to the brain, causing an embolic stroke. Reduced cerebral perfusion. The semi-upright position, especially without full body support, can compromise the efficiency of blood flow back to the brain, leading to periods of reduced cerebral perfusion. Baroreflex dysfunction. The baroreflex, which regulates blood pressure, works most effectively when the body is flat. Sleeping upright weakens this reflex, leading to greater blood pressure instability, which stresses fragile blood vessels. Who is most vulnerable? Seniors with poor circulation, a history of DVT, heart conditions, or those on diuretics are particularly vulnerable. The scientific adjustment. Adjustable bed or wedge system. If elevated sleep is medically necessary, e.g. for severe GERD, heart failure, use a hospital-style adjustable bed or a full torso wedge pillow system that elevates the entire upper body without compressing the lower limbs. This ensures proper spinal alignment and minimizes venous pooling. Regular leg movement. If recliner naps are unavoidable, ensure regular leg movement and stretching before and after to promote circulation. Avoid tight clothing or socks that could further restrict blood flow. Sleeping on the right side, with arm under pillow, most dangerous side position. The habit. Millions find comfort sleeping on their side, often tucking an arm under the pillow or head. The right side is a common preference. The danger explained. Physiological impact. This seemingly innocuous habit is one of the most dangerous sleeping positions for the cerebrovascular system. Major artery and vein compression. Lying on the right side, especially with an arm wedged underneath, places direct, prolonged pressure on crucial arteries and veins in the neck and shoulder. This includes the right carotid artery, which supplies blood to the brain's anterior circulation, and the subclavian artery. Compression significantly slows blood flow. Venous compression. The veins draining blood from the head and neck are also compressed, leading to blood pooling and stasis. Clot formation. Stasis-induced thrombosis. Prolonged compression and slowed blood flow create ideal conditions for blood to thicken and form clots, stasis-induced thrombosis. These clots can dislodge, travel to the brain, and cause an ischemic stroke, often occurring in the early morning hours when blood pressure naturally fluctuates. Brachial plexus compression. Beyond vascular issues, this position also compresses the brachial plexus, a bundle of nerves running through the shoulder and down the arm. This can cause not just numbness, pins and needles, but also nerve distress signals that can fragment sleep and contribute to microvascular damage over time. Who is most vulnerable? Individuals with existing carotid artery stenosis, general atherosclerosis, or those with reduced nerve resilience due to age are highly vulnerable. The scientific adjustment. Left side sleeping with proper support. Switch to sleeping on your left side. This is generally considered safer for cardiac function, reducing pressure on the heart, and less likely to compress major arteries on the dominant side of the head. Strategic pillow use. Use a contoured pillow that maintains neutral neck alignment. Crucially, keep your arms resting forward or alongside your body, never directly underneath your head or torso. A pillow between your knees can help maintain this position. Frequent tossing and turning, poor sleep quality. The habit, constant shifting, frequent waking, and an inability to maintain a stable sleep position throughout the night are often attributed to normal aging or musculoskeletal pain. The danger explained, physiological impact. Frequent tossing and turning is more than just a sign of poor sleep quality. It can be a direct trigger for vascular instability and stroke. Intermittent cerebral hypoperfusion. Each sharp movement, rolling, head turning, adjusting the neck, can temporarily alter blood flow to and from the brain. In an older adult with stiffened arteries and narrowed veins, these movements create brief but repeated periods of reduced cerebral circulation, intermittent hypoperfusion. This can lead to localized oxygen deprivation and stress on vessel walls. Blood pressure. Dysregulation. Fragmented sleep prevents the body from achieving the stable, controlled dip in blood pressure that normally occurs during deep sleep. Instead, blood pressure can fluctuate wildly, leading to overnight spikes, especially in the early morning, that are key triggers for stroke. Cortisol elevation. Poor sleep quality maintains elevated cortisol levels, a stress hormone that further contributes to blood pressure instability and systemic inflammation, both detrimental to vascular health. Glymphatic system. Disruption. Deep, uninterrupted sleep is essential for the glymphatic system, the brain's waste clearance mechanism. Frequent tossing and turning disrupts this process, allowing metabolic toxins and inflammatory byproducts to accumulate, contributing to long-term vascular inflammation and neurodegeneration. Who is most vulnerable? Individuals with underlying hypertension, undiagnosed sleep apnea, or those experiencing chronic pain. The scientific adjustment. Address root causes. Treat restlessness as a symptom. Investigate potential underlying causes with your doctor, such as undiagnosed sleep apnea, restless leg syndrome, or chronic pain. Optimize sleep hygiene. Avoid late caffeine and alcohol. Ensure your room is cool, dark, and quiet. Use layered bedding for temperature control. Supportive sleep aids. Utilize a full-body pillow to cradle joints and prevent sudden, unconscious movements. A specialized cervical pillow can maintain stable neck alignment. Nocturnal hydration. Keep a glass of water by your bedside to prevent dehydration, which can thicken blood. Sleeping after skipping blood pressure or heart medication. The habit, forgetting a dose or intentionally skipping evening medication, e.g., blood pressure drugs, anticoagulants, due to feeling fine, side effects, or simple oversight. The danger explained, physiological impact. This is one of the most direct and dangerous habits, as it removes a critical protective shield for the cardiovascular system. Loss of blood pressure control. Blood pressure naturally follows a circadian rhythm, dipping at night. For individuals with hypertension, this rhythm is often dysregulated. Medications are designed to maintain stability. Skipping an evening dose, particularly of beta blockers, calcium channel blockers, or ACE inhibitors, can lead to uncontrolled blood pressure spikes overnight, often between 2 to 6 a.m., precisely when most strokes occur. Arrhythmias and clot risk. If you have atrial fibrillation, AFib, or other heart conditions, skipping anticoagulant medication, blood thinners, removes the vital protection against clot formation. Uncontrolled AFib in particular dramatically increases stroke risk. Without medication, the heart rhythm can become irregular, leading to blood stasis in the atria and clot development. Increased platelet activity. Sudden surges in blood pressure irritate the arterial lining, making platelets, cells involved in clotting, more active and likely to adhere to vessel walls, initiating clot formation in already narrowed arteries. Who is most vulnerable? Individuals with diagnosed hypertension, atrial fibrillation, a history of stroke or TIA, or those on any form of anticoagulant therapy. The scientific adjustment. Strict adherence schedule. Establish a strict, non-negotiable medication schedule. Pill reminders and organizers. Use a daily pill organizer, set smartphone alarms, or ask a loved one to provide a reminder. Backup medication strategy. Keep a small emergency supply of essential medications in a prominent, easily accessible location. Doctor consultation. Never discontinue or alter medication without consulting your doctor. Discuss any side effects or concerns with them to find alternative solutions. Sleeping in cold rooms without proper neck support. The habit, preferring a very cool or cold bedroom environment, often with poor or no pillow support, leading to a misaligned neck. The danger explained, physiological impact. While a cool room can promote sleep, an excessively cold environment, especially combined with inadequate neck support, can compromise cerebral blood flow. Vasoconstriction. Cold temperatures cause vasoconstriction, the narrowing of blood vessels. This is a survival mechanism to conserve heat, but it is dangerous when it occurs in the neck, affecting the carotid and vertebral arteries that supply the brain. Compromised arterial flow. When already narrowed arteries in the neck constrict further due to cold, blood flow to the brain is significantly reduced. This is exacerbated by cervical spondylosis, age-related degenerative changes in the neck spine, which many seniors experience. Poor pillow support, too flat, too high, or absent, can also cause subtle but prolonged misalignment or compression of these vessels. Increased blood pressure. The body may respond to cold-induced vasoconstriction by increasing systemic blood pressure to try and maintain cerebral perfusion, placing further stress on fragile vessels. Hypoxia risk. Reduced blood flow means reduced oxygen delivery to the brain, leading to periods of hypoxia that increase clot risk. Who is most vulnerable? Seniors with cervical spondylosis, atherosclerosis, or those prone to Raynaud's phenomenon or cold sensitivity. The scientific adjustment, optimal room temperature. Maintain a balanced room temperature, ideally between 65–68 degrees, 18 to 20 degrees. A cool room is good, a cold room is not. Ergonomic neck support. Invest in a medium firm contoured pillow that keeps your head and neck in neutral alignment with your spine. Avoid sleeping with your chin tucked sharply into your chest or your head cocked to the side. Ensure the pillow adequately fills the natural curve of your neck. Sleeping immediately, after heavy drinking or a big meal. The habit, a ritual of heavy eating, especially fatty, salty meals, and or significant alcohol consumption shortly before bedtime, believing it aids sleep. The danger explained, physiological impact. This combination creates a perfect storm for vascular distress during sleep. Digestive burden and blood redistribution. A large, fatty or sugary meal eaten late at night demands significant digestive effort. Blood is preferentially shunted from the brain to the gut to support digestion. This temporary reduction in cerebral blood flow can be critical in older adults with already compromised arteries. Dehydration and blood viscosity. Alcohol is a diuretic promoting dehydration. Both heavy meals, especially those high in sodium, and alcohol consumption can contribute to increased blood viscosity, thicker blood, making clot formation more likely. Alcohol's biphasic effect on blood pressure. Alcohol initially causes vasodilation, blood vessel widening, leading to a temporary drop in blood pressure and drowsiness. However, as the alcohol is metabolized, a rebound effect occurs, causing sudden vasoconstriction and a significant surge in blood pressure, often peaking 3 to 4 hours after consumption. This rapid, uncontrolled fluctuation in blood pressure is a potent trigger for stroke, especially during the vulnerable early morning hours. Arrhythmias. Alcohol can also directly induce cardiac arrhythmias, such as atrial fibrillation, further increasing stroke risk. Fragmented sleep. While alcohol may induce drowsiness, it severely disrupts sleep architecture, suppressing REM sleep and leading to fragmented non-restorative sleep, which exacerbates all other vascular risk factors. Who is most vulnerable? Individuals with hypertension, cardiac arrhythmias, sleep apnea, or existing vascular disease. The scientific adjustment, timing of meals and drinks. Allow at least 2 to 3 hours between your last heavy meal and bedtime. If consuming alcohol, do so in moderation, and at least 4 hours before sleep. Hydration. Drink water with your dinner and throughout the evening to counter the dehydrating effects of alcohol and salty foods. Balanced evening meals. Opt for lighter, easily digestible meals in the evening, avoiding excessive sodium, sugar, and unhealthy fats. Understand alcohol-induced sleep. Recognize that alcohol-induced drowsiness is not healthy restorative sleep. It is disruptive and harmful to brain function. Sleep isn't just rest, it's protection. If you've made it this far, I commend you. You've demonstrated a commitment to understanding the truth about how sleep can quietly shape the health of your brain. What you've just learned isn't about fear, it's about power. The power that comes from awareness, from knowing what's happening inside your body while the world sleeps. At this stage in life, knowledge is not just helpful, it's protective. Every choice you make now, no matter how small, holds immense weight. We've explored 9 silent habits that may seem harmless, positions of comfort, routines of familiarity, decisions made out of pain or fatigue. Yet, each one has the potential to slowly, quietly push the brain toward danger. Sleeping flat without a pillow, face down in a recliner, under a heavy blanket or on your preferred arm. Frequent tossing and turning, skipping vital medication, sleeping in the cold without proper neck support, or going to bed with a full belly and alcohol. Each of these over time creates conditions for blood to stagnate, thicken and clot. In an aging body already facing natural changes, stiffened arteries, slower circulation, less oxygen resilience, these clots are not just possible, they are a significant concern. But here is the most important truth I can offer you as a medical professional. Most strokes that happen during sleep are preventable. Let that settle in. They are not inevitable. They are not random. They are often the result of routines we never questioned, subtle signals from the body we ignored, or comfort habits that no longer serve us as we age. You still have control. You still have the ability to change how you sleep, how you care for your brain, and how you protect your tomorrow. Because sleep is not just rest. Sleep is when the brain restores blood flow, clears toxins, balances hormones, and prepares for another day. Sleep is when your brain is most vulnerable, but also when it's most open to healing, if you let it. Start tonight. Elevate your head slightly. Sleep on your left side if comfortable. Ensure proper neck support. Avoid late drinks and heavy meals. Take your medications without fail. Choose breathable bedding. Prioritize hydration. Create a sleep space that honors the years you've lived and the vibrant life you still want to enjoy. These are not dramatic changes. They are subtle shifts, but they carry immense weight. In a world full of things we can't control, this is one part of your health where your decisions matter every single night. You are not too old to change. You are not too far along to protect yourself. And you are never too late to learn how to sleep, not just for comfort, but for survival. As is often emphasized in neurology, it's not about how long you sleep. It's about how wisely you sleep. So tonight, as you pull back the covers and lay your head down, ask yourself, is the way I'm sleeping helping my brain or hurting it? Because when you protect your sleep, you protect everything, your speech, your memory, your balance, your independence. You protect the very essence of who you are. And that is always worth it. These insights are meant to empower you to live fully and authentically. Now I'd love to hear from you. Take a moment to reflect and share one thing you've learned and plan to apply in your own life. Let's support each other on this journey toward embracing these truths. If you found this video valuable, please leave a comment with 1. If not, feel free to comment with 0 to let us know how we can make better content for you. Your feedback means a lot to us. Don't forget to like, share, and subscribe to our YouTube channel for more essential health content like this. Thank you for watching, and here's to protecting your brain and living life on your own terms.